What if there was a series that explored medical vocabulary in detail, giving you not just words but pronunciation, form, definition, and real life context? Well, I've got you covered. Hi, I'm Jer, and welcome to Learning English Pro, the channel for healthcare professionals like you to excel in English and advance in your career. In today's lesson, we'll explore 50 essential terms for healthcare with the focus on phlebotomy. Whether you're a nurse, doctor, or any healthcare professional, this lesson will help you communicate clearly and confidently in a medical setting. We'll go through each term just like a real Cambridge English lesson, covering pronunciation, word form, definition, and example sentences and context. And this is the third lesson in my healthcare vocabulary series. The first two lessons covered mental health and physiotherapy, but don't worry if you missed them. Both lessons are included in this video, so just stay tuned. That means that this video contains a total of 150 essential medical terms, definitions, and example phrases, an incredibly valuable resource for anyone working in healthcare. To help my student members practice and reinforce what they learn, I've created a PDF guide for this lesson, which includes all the terms, definitions, and content, plus additional exercises to improve your understanding. As a student member of Learning English Pro, you get a new guide with every new lesson. If you'd like to join, the link is in the video description. Alright, let's get started with 50 essential phlebotomy terms for healthcare professionals. To start, let's cover some essential syringe-related terms. These are tools used in injections, blood draws, and sample collection. Understanding their names and functions will help you communicate clearly in a medical setting. Our first term is needle. Needle. Needle is a synonym which is commonly used interchangeably with syringe. Though technically, the needle is just one part. It is the sharp metal tip that penetrates the skin. Let's take a look at our example sentence. A 23 gauge needle is commonly used for blood collection. Let's move on to hypodermic syringe. Repeat after me. Hypodermic syringe. This is a syringe with a fine needle used for subcutaneous or intramuscular injections. Hypodermic syringes are commonly used for vaccines. Vacuum tube. Vacuum tube. A vacuum tube is used for blood collection, often instead of a traditional syringe. For venipuncture, we usually use a vacuum tube system. Auto-injector. Auto-injector. This is a device that administers a dose automatically without the need for manual injection. An epinephrine auto-injector is used for severe allergic reactions. Barrel. Barrel. The barrel is the cylindrical body of a syringe that holds the liquid. Check the barrel to ensure the correct dosage. Bevel. Bevel. This is the angled tip of the needle that facilitates smoother insertion. Insert the bevel facing up for a less painful injection. Hub. Hub. The hub is the base of the needle that attaches to the syringe. Twist the hub securely to attach the needle. Our next term is luer lock. Luer lock. And this is a type of syringe tip that allows the needle to be securely twisted on. Luer lock syringes help prevent accidental detachment of the needle. Slip tip. Slip tip. This is a simple push-on connection for needles. Slip-tip syringes allow quick and easy needle attachment. Safety cap. Safety cap. A safety cap is a protective cover for the needle to prevent accidental injuries. Always replace the safety cap before disposal. Now let's move on to key equipment and terms used in phlebotomy. From blood collection tubes to centrifuges, these are the tools and concepts every healthcare professional should know. Tourniquet. Tourniquet. A tourniquet is a band used to constrict blood flow to make veins more prominent. Apply the tourniquet about 3 inches above the puncture site. Venipuncture. Venipuncture. This is the process of inserting a needle into a vein to draw blood. Proper venipuncture technique reduces the risk of complications. Butterfly needle. Butterfly needle. This is a small needle with flexible tubing for delicate veins. Use a butterfly needle for patients with fragile veins. Lancet. Lancet. A lancet is a small, sharp tool used to puncture the skin for capillary blood collection. A lancet is commonly used for glucose testing. Vacutainer. Vacutainer. A vacutainer is a blood collection system that includes a tube, needle, and holder. Let's have a look at our example. Choose the correct vacutainer tube based on the required test. Centrifuge. Centrifuge. This is a machine used to separate blood components. Place the blood samples in the centrifuge for proper separation. Our next term is serum. Serum. Serum is the liquid portion of blood that remains after clotting. The lab requires a serum sample for the test. Plasma. Plasma. Plasma is the fluid part of blood that contains clotting factors. Unlike serum, plasma contains fibrinogen. Hematoma. Hematoma. A hematoma is a localized collection of blood outside blood vessels. A hematoma may form if pressure is not applied correctly. Capillary. Capillary. This is a tiny blood vessel where blood is collected from the finger or heel. Capillary blood is often used for rapid glucose testing. Anticoagulant. Anticoagulant. An anticoagulant is a substance that prevents blood clotting. Heparin is an anticoagulant used in certain blood tests. Hemolysis. Hemolysis. This is the breakdown of red blood cells, which can often affect test results. Avoid shaking the tube forcibly to prevent hemolysis. Needle stick injury. Needle stick injury. This is an accidental puncture by a used needle. Report any needle stick injury immediately to the supervisor. Gauge. Gauge. Gauge is the thickness of a needle. Smaller numbers indicate a larger needle. A 21 gauge needle is commonly used for routine blood draws. Evacuated tube. Evacuated tube. A vacuum-sealed container used for blood collection. Select the appropriate evacuated tube based on the test ordered. Phlebotomy isn't just about equipment, it's about actions. In this section, we'll focus on important verbs used during blood collection and handling, ensuring you understand the correct terminology for each step of the procedure. Palpate. Palpate. To palpate is to feel with the hands, in this case, to locate veins. Always palpate the vein before inserting the needle. Anchor. Anchor. This verb means to hold the vein steady before puncture. Use your non-dominant hand to anchor the vein. Insert. Insert. This means to introduce the needle into the vein. Gently insert the needle at a 15-degree angle. Withdraw. Withdraw. Withdraw means to remove the needle from the vein. Slowly withdraw the needle once blood collection is complete. Invert. Invert. This means to gently mix blood with the additive in the tube. Invert the tube 5 to 10 times to ensure proper mixing. Label. Label. To label means to mark the blood sample with patient details. Always label the sample immediately after collection. Dispose. Dispose. To dispose means to discard needles and biohazardous waste safely. Dispose of used needles in the sharps container. Recollect. Recollect. This means to draw blood again if the first sample is inadequate. A hemolyzed sample may require you to recollect the blood. Aspirate. Aspirate. In this case, aspirate means to pull back on the syringe to check for blood return. Never aspirate when using a vacuum collection system. Apply. Apply. And this means to place pressure or a bandage on the puncture site. Apply firm pressure to prevent bruising. To describe veins, needles, and blood samples accurately, you need the right adjectives. This section will help you use precise language when assessing patients and handling samples. Our first adjective is fragile. Fragile. And this describes something which is easily damaged, often used to describe veins. Let's take a look at our example. Elderly patients often have fragile veins. Superficial. Superficial. This describes something located near the surface, like a vein, making it easier to access. Use a superficial vein for easier blood collection. Deep. Deep. This describes a vein which is situated far below the skin's surface. Some patients have deep veins that require ultrasound guidance. Next up, we have clotted. Clotted. Clotted describes blood that has solidified. A clotted sample cannot be used for a coagulation test. Sterile. Sterile. If something is sterile, it is free from bacteria or contamination. Always use a sterile needle for venipuncture. Finally, let's look at common phrases used in phlebotomy. These collocations are essential for giving instructions, explaining procedures, and ensuring smooth communication with patients and colleagues. Locate a vein. Locate a vein. This means to identify a suitable vein for venipuncture. Use a warm compress to help locate a vein in difficult cases. Confirm patient identity. Confirm patient identity. And of course, this means to verify the patient's details before drawing blood. Always confirm patient identity before collecting a sample. Apply a tourniquet. Apply a tourniquet. And this means to restrict blood flow and make veins more visible. Apply a tourniquet for no longer than 1 minute. Insert the needle. Insert the needle. And this means to puncture the vein with the needle. Slowly insert the needle at the correct angle. Draw blood. Draw blood. This common phrase means to collect a blood sample. Use the correct technique to draw blood efficiently. Remove the tourniquet. Remove the tourniquet. This means to release the restriction after blood flow is established. Remove the tourniquet before withdrawing the needle. Prevent hemolysis. Prevent hemolysis. And this means to prevent breaking red blood cells. Handle the sample carefully to prevent hemolysis. Dispose of sharps. Dispose of sharps. This phrase means to safely discard needles and other sharp instruments. Always dispose of sharps in designated containers. Fill the tube. Fill the tube. This means to allow blood to flow into the collection tube. Hold the tube at an angle to fill the tube correctly. Check for bleeding. Check for bleeding. And this final phrase means to ensure the puncture site is still not bleeding. After removing the needle, check for bleeding and apply pressure. Well done! You've just learned 50 essential terms for phlebotomy, covering tools, procedures, and common phrases used in medical settings. Student members, don't forget to download the PDF guide for this lesson. It includes all the vocabulary from this lesson plus exercises to reinforce your learning. You can access it by joining as a student member. The link is in the video description. And stay tuned, coming up is the next lesson in the series, which focuses on 50 essential terms for mental health, another crucial area for healthcare professionals. Make sure to subscribe so you don't miss out on the next in the series. Healthcare is a field where communication is just as important as medical knowledge. Whether you're a doctor, nurse, therapist, or any healthcare professional, mastering English is key to building trust with patients, collaborating with colleagues, and excelling in your career. That's why I've created this healthcare vocabulary series, a deep dive into essential English terms used across different medical fields. Each lesson in this series is packed with tons of vocabulary phrases and professional language tips to help you sound natural and confident in any healthcare setting. Today's lesson is just one of many, and there's so much more to come. Hi, I'm Jer, and this is Learning English Pro, the channel for healthcare professionals to excel in English and advance in your careers. Today, we're exploring 50 essential healthcare terms with the focus on mental health. Mental health is a critical part of patient care in all healthcare contexts. Whether you're a psychologist, a therapist, nurse, doctor, or any professional working with patients, this lesson is packed with valuable vocabulary you'll use every day. For each of the 50 terms, you'll perfect your pronunciation, understand the meaning, and get real-life professional context with example sentences. This is a complete Cambridge-style English lesson designed to help you master meaning, form, and pronunciation for professional use. To take your learning even further, I've created a useful downloadable guide with all the vocabulary plus exercises for this lesson. It's available exclusively for my student members on the membership tab. Want access? You can join today and unlock this PDF plus so much more. The link to join is in the video description. Alright, enough business. Let's get straight into our 50 essential healthcare terms for mental health. Our first set of words focus on diagnostic terms. Our first word is neurodivergent. Repeat after me. Neurodivergent. This adjective describes individuals whose neurological development and functioning differ from societal standards of normal. Let's take a look at our example sentence. The patient identifies as neurodivergent, exhibiting traits consistent with autism spectrum disorder. Let's move on to bipolar disorder. Bipolar disorder. This is a mental health condition characterized by extreme mood swings, including manic and depressive episodes. The patient has been diagnosed with bipolar disorder and is currently experiencing a manic phase. Next up is schizophrenia. Schizophrenia. This word describes a severe mental disorder involving distorted thinking, perceptions, and a diminished ability to function. Early intervention is crucial in managing schizophrenia to improve long-term outcomes. Next up, we have obsessive-compulsive disorder, better known as OCD. This disorder is characterized by unwanted recurring thoughts or obsessions and repetitive behaviors or compulsions. Let's check out our example sentence. Cognitive behavioral therapy is effective in treating patients with obsessive-compulsive disorder. Another common disorder is post-traumatic stress disorder, better known as PTSD. This is a condition triggered by experiencing or witnessing a traumatic event, leading to severe anxiety and flashbacks. The veteran was diagnosed with PTSD following his return from active duty. Our next batch of words deals with symptomatic terms. Anhedonia. Repeat after me. Anhedonia. This noun describes an inability to experience pleasure from activities usually found enjoyable. The patient's anhedonia is a significant barrier to engaging in therapeutic activities. Affective flattening. Affective flattening. This term describes a reduction in the expression of emotions, often seen in facial expressions and voice tone. Affective flattening was observed during the mental status examination. Let's move on to our next term, hypervigilance. Hypervigilance. This is an enhanced state of sensory sensitivity and exaggerated awareness of surroundings. Hypervigilance in the patient suggests underlying anxiety issues. Our next word is rumination. Rumination. Rumination is the act of continuously thinking about the same thoughts, often negative, which can contribute to depression. Let's check out our example sentence. Addressing rumination is essential in the cognitive therapy of depression. Psychomotor agitation. Psychomotor agitation. This term describes unintentional and purposeless motions stemming from mental tension and anxiety. The patient's psychomotor agitation has decreased with the new medication regime. Our next topic is treatment-related terms. Psychopharmacology. Psychopharmacology. This is the study of the use of medications in treating mental disorders. Let's check out our example sentence. Advancements in psychopharmacology have improved outcomes for patients with mood disorders. Let's move on to cognitive behavioral therapy, better known as CBT. This is a type of psychotherapy that helps patients identify and change negative thought patterns and behaviors. CBT has been effective in reducing symptoms of anxiety and depression in adolescents. Next up, we have electroconvulsive therapy, also known as ECT. This is a medical treatment involving electrically induced seizures to treat severe mental disorders. ECT is considered when patients with severe depression do not respond to medication. Next up, we have mindfulness-based stress reduction, also known as MBSR. This is a therapeutic approach combining mindfulness meditation and yoga to reduce stress. MBSR programs have been integrated into treatment plans for patients with chronic anxiety. Let's move on to dialectical behavior therapy, also known as DBT. This is a form of therapy designed to help individuals manage intense emotions and reduce self-destructive behaviors. DBT is particularly effective for patients diagnosed with borderline personality disorder. Our next section deals with descriptive terms used in mental health care. Euthymic. Euthymic. This adjective pertains to a normal, stable mood state, neither depressed nor manic. Let's check out our example sentence. The patient has remained euthymic for several months with ongoing treatment. Let's move on to labile. Repeat after me. Labile. In mental health, labile describes emotions characterized by rapid and unpredictable changes. The patient's mood was labile, shifting from tears to laughter within minutes. Our next term is dysphoric. Dysphoric. Dysphoric is used to describe when a patient is experiencing a state of unease or generalized dissatisfaction. The patient reported a dysphoric mood throughout the past week. Psychosomatic. Psychosomatic. This term relates to physical symptoms caused or aggravated by mental factors. Stress can lead to psychosomatic symptoms such as headaches and stomach aches. Somatic. Somatic. And this adjective describes symptoms relating to the body, especially as distinct from the mind. The patient presented with somatic complaints, including fatigue and muscle pain. Our next batch of words relate to common behavioral terms used in mental health care. If you've been affected by any of the terms covered, please make sure to seek help from a professional. Self-harm. Self-harm. This is the act of deliberately inflicting pain or injury on oneself. The patient has a history of self-harm but denies any recent incidents. Suicidal ideation. Suicidal ideation. This is the presence of thoughts about or planning suicide without necessarily making an attempt. The patient reports experiencing passive suicidal ideation, but denies any intent or plan to act on it. Addiction. Addiction. Addiction is a compulsive dependency on a substance or behavior, often leading to harmful consequences. The patient's addiction to opioids has led to significant health complications. Compulsion. Compulsion. A compulsion is a repetitive, irresistible urge to perform a behavior, often linked to OCD. Hand washing has become a compulsion for the patient, interfering with daily activities. Delusion. Delusion. A delusion is a firmly held, false belief that is resistant to evidence or logic. The patient exhibits delusions of grandeur, believing they have supernatural abilities. Hallucination. Hallucination. This is a sensory perception that occurs in the absence of an external stimulus, often auditory or visual. Auditory hallucinations are a common symptom in schizophrenia. Derealization. Derealization. This is a feeling of detachment from one's surroundings, as if the external world is unreal. During periods of high anxiety, the patient experiences derealization, experiencing the world as dreamlike. Disassociation. Disassociation. This is a mental process where a person disconnects from thoughts, feelings, memories, or identity. The patient disassociates during stressful events, reporting memory gaps and emotional numbness. Hyperfixation. Hyperfixation. An intense and prolonged focus on a specific interest or activity, often linked to ADHD or autism. The patient describes hyperfixation on video games, leading to neglect of personal hygiene. Codependency. Codependency. Codependency is a behavioral condition where one person enables another's addiction or unhealthy behavior. The therapist is working with the patient to establish boundaries in their codependent relationship. Emotional dysregulation. Emotional dysregulation. This is difficulty managing emotional responses appropriately. Patients with borderline personality disorder often struggle with emotional dysregulation. In our next section, we're going to take a look at common mental health verbs. Diagnose. Diagnose. To diagnose is to identify a medical condition based on symptoms and tests. The psychiatrist diagnosed the patient with generalized anxiety disorder. Medicate. Medicate. To medicate is to administer medication as treatment. The patient was medicated with an SSRI to manage depressive symptoms. Prescribe. Prescribe. This verb means to authorize the use of specific medication or treatment. The doctor prescribed an antidepressant to help regulate mood. Stabilize. Stabilize. This word means to bring a patient's condition to a steady, controlled state. The goal is to stabilize the patient's mood swings through therapy and medication. Let's move on to regress. Regress. To regress is to revert to a previous, less advanced state of mental or emotional well-being. After discontinuing therapy, the patient showed signs of emotional regression. Suppress. Suppress. This word means to reduce or inhibit a mental or emotional response. The medication helps suppress intrusive thoughts in patients with OCD. Our next term is to cognitively reframe. Cognitively reframe. And this means to shift perspective on a thought or belief to reduce stress. Cognitive reframing is a key technique in treating negative thought patterns. Disclose. Disclose. To disclose means to reveal or share personal information, often in a therapeutic setting. The patient was hesitant to disclose past trauma, but gradually opened up. Reinforce. Reinforce. To reinforce means to strengthen a behavior or thought pattern, either positively or negatively. Therapists use positive reinforcement to encourage healthy coping strategies. Validate. Validate. To validate is to acknowledge and affirm someone's emotions or experiences. It's important to validate the patient's feelings before offering solutions. In our final section, we're going to take a look at medications and therapy-related terms used in mental health care. First up, we have SSRI, or selective serotonin reuptake inhibitor. This is a class of antidepressants that increase serotonin levels in the brain. Let's take a look at our example sentence. SSRIs, like fluoxetine, are commonly prescribed for depression and anxiety disorders. Anxiolytic. Anxiolytic. An anxiolytic is a medication that reduces anxiety. The patient was prescribed an anxiolytic to manage panic attacks. Mood stabilizer. Mood stabilizer. A mood stabilizer is a type of medication that helps balance mood fluctuations, often used in bipolar disorder. Lithium is a widely used mood stabilizer for bipolar disorder. Neuroleptic. Neuroleptic. Neuroleptic is another term for antipsychotic medication used to treat conditions like schizophrenia. Neuroleptics can help manage symptoms of psychosis but may have side effects. Exposure therapy. Exposure therapy. Exposure therapy is a psychological treatment that involves gradual exposure to anxiety triggers to reduce fear. Exposure therapy has been highly effective for patients with phobias. Trauma-informed care. Trauma-informed care. This is an approach that recognizes and responds to the impact of trauma in patient care. Trauma-informed care ensures that the patient feels safe and respected in therapy. Somatic therapy. Somatic therapy. Somatic therapy is a therapeutic approach that focuses on the connection between mind and body in processing trauma. Somatic therapy techniques, like grounding exercises, help patients reconnect with their bodies. Psychosocial intervention. Psychosocial intervention. This is a non-medical approach to improving mental health through social and behavioral strategies. Group therapy is a common form of psychosocial intervention. Mindfulness meditation. Mindfulness meditation. This is a practice that involves focusing on the present moment to improve mental well-being. Mindfulness meditation is integrated into therapy to help manage stress and anxiety. Holistic psychiatry. Holistic psychiatry. This is an approach that combines conventional psychiatry with alternative and complementary methods. Holistic psychiatry considers lifestyle, diet, and emotional well-being alongside medication. Well done, you've just completed this lesson on 50 essential healthcare terms for mental health. This is just the beginning. There's so much more to learn in the healthcare vocabulary series. And don't go anywhere because coming up next is our next batch of 50 healthcare terms. And this time the topic is physiotherapy. Did you know that 80% of adults will experience back pain at some point in their lives, and that rehabilitation professionals, including physiotherapists, are in higher demand than ever? If you're preparing for the OET exam, working in rehabilitation, or simply looking to improve your medical English, mastering the right vocabulary is crucial. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. Today, we're diving into 50 essential healthcare vocabulary terms, with a focus on physiotherapy, movement, and rehabilitation. This lesson comes from a student member request. And if you're a student member of Learning English Pro, your requests get priority. Plus, you'll get a handy downloadable guide with each lesson. The one for this lesson includes all the vocabulary from this lesson, fun exercises to test your knowledge, and links to additional medical English guides from Learning English Pro. If you want access to these exclusive materials, the link to join is in the video description. Alright, enough business. Let's get started with 50 key healthcare vocabulary terms for physiotherapy. We'll cover pronunciation, form, meaning, and context, just like a real Cambridge English lesson. Let's begin. First up, we're going to look at nouns relating to physiotherapy. And our first term is joint stability. Repeat after me. Joint stability. This term refers to the ability of a joint to maintain proper alignment during movement. Let's take a look at our example sentence. Joint stability is essential for athletes to prevent injuries during sports. Let's move on to our next term, which is muscle atrophy. Muscle atrophy. Muscle atrophy is the wasting away or decrease in muscle mass due to inactivity. Extended bed rest can lead to muscle atrophy, making rehabilitation more difficult. Tendinitis. Tendinitis. This is the inflammation of a tendon, often caused by repetitive motion. The runner developed tendinitis from overtraining without proper rest. Let's move on to myofascial release. Repeat after me. Myofascial release. This is a therapy technique used to relieve muscle tightness and pain. Myofascial release techniques can help reduce tension in tight muscles. Our next term is gait analysis. Gait analysis. This is the study of a person's walking pattern to detect abnormalities. Let's check out our sentence example. Gait analysis showed that the patient was favoring one leg after surgery. Our sixth noun is ergonomics. Ergonomics. Ergonomics is the science of designing workspaces to reduce strain and injury. Good ergonomics in the workplace can prevent chronic back pain. Prosthesis. Repeat after me. Prosthesis. A prosthesis is an artificial body part, such as a limb or joint replacement. After losing his leg in an accident, he was fitted with a prosthesis. Let's move on to orthotics. Orthotics. Orthotics are custom-designed inserts or devices to support and align the feet. She wears orthotics in her shoes to support her arches and prevent pain. Our next term is balance board. Balance board. A balance board is a tool used in therapy to improve stability and coordination. The therapist recommended using a balance board to improve coordination. Spinal alignment. Spinal alignment. This refers to the correct positioning of the spine to prevent pain and injury. Spinal alignment is crucial for reducing chronic back and neck pain. Compression bandage. Compression bandage. A compression bandage is a tight wrap used to reduce swelling and support injured areas. The doctor applied a compression bandage to control the swelling. Kinesiology tape. Kinesiology tape. This is a flexible tape used to support muscles and reduce pain. Kinesiology tape helps support the athlete's knee during recovery. Neuroplasticity. Neuroplasticity. This refers to the brain's ability to reorganize itself by forming new connections. Neuroplasticity allows stroke patients to regain lost motor functions. Our next term is TENS, which stands for transcutaneous electrical nerve stimulation. And this refers to a device that uses electrical impulses for pain relief. The patient uses a TENS machine to manage chronic pain in his lower back. Biomechanics. Biomechanics. Biomechanics is the study of human movement and mechanics. Let's look at our example sentence. Biomechanics helps us understand how different movements affect the body. Rehabilitation Center. Rehabilitation Center. This is a medical facility focused on recovery from injury or surgery. He spent 3 months in a rehabilitation center after his knee surgery. Soft tissue therapy. Soft tissue therapy. This is a treatment that involves manipulation of muscles and tendons. Soft tissue therapy reduced the tension in his shoulders and neck. Motor control. Motor control. Motor control is the ability to regulate and direct movement. Motor control exercises helped the patient regain movement in his arm. Let's move on to bursitis. Bursitis. This is an inflammation of the fluid-filled sacs that cushion joints. Bursitis in her shoulder made lifting heavy objects painful. Our 20th noun is the term scar tissue. Scar tissue. Scar tissue is thickened fibrous tissue that forms after an injury or surgery. Scar tissue formed after the surgery, affecting her range of motion. Well done, that's 20 nouns relating to physiotherapy and movement. And next up, we're going to take a look at some verbs relating to physiotherapy and movement, so get ready. All the definitions I give will be in the context of physiotherapy and movement. The first verb we will look at is mobilize. Mobilize. Mobilize means to move a joint or muscle to restore function. And let's take a look at our example sentence. The therapist mobilized the patient's stiff ankle to improve flexibility. Strengthen. Strengthen. Strengthen means to build up muscle power and endurance. Resistance exercises help strengthen weak muscles after an injury. Let's move on to retrain. Retrain. And this word means to teach a body part to function again after injury. The patient had to retrain his walking pattern after a stroke. Contract. Contract. As a verb, contract means to tighten a muscle actively. He was instructed to contract his abs during the exercise. Stabilize. Stabilize. In physiotherapy, to stabilize means to make steady or maintain proper alignment. Bracing techniques help stabilize her injured knee. Activate. Activate. This means to engage a muscle group during movement. The exercise activates the glutes and improves lower body strength. Realign. Realign. This word means to restore correct positioning of bones or joints. The chiropractor realigned his spine to relieve pressure on the nerves. Next up, we have elongate. Elongate. This word means to stretch or lengthen a muscle. Stretching helps elongate muscles and improve flexibility. Rehabilitate. Rehabilitate. This word means to restore strength and function after an injury. The clinic specializes in rehabilitating sports-related injuries. Engage. Engage. To engage means to actively use a muscle group. Engaging the core is crucial for proper posture during exercise. Next up, we have loosen. Loosen. And this means to reduce stiffness or tightness in muscles or joints. Massage therapy helped loosen tight muscles in his back. Reprogram. Reprogram. This means to train the nervous system to adapt to new movement patterns. Stroke patients need to reprogram their nervous system for movement recovery. Reinforce. Reinforce. This means to strengthen a movement or posture through repetition. The therapist reinforced proper walking techniques through repetition. Optimize. Optimize. To optimize means to improve efficiency and effectiveness in movement. Optimizing movement patterns can enhance athletic performance. Prevent. Prevent. To prevent means to take steps to avoid injury or deterioration. Wearing proper footwear can prevent ankle injuries. That's all the verbs we're going to cover. Next, let's move on to some adjectives relating to physiotherapy and movement. Our first adjective is weight-bearing. Weight-bearing. And this term describes something supporting body weight while standing or moving. Weight-bearing exercises strengthen bones and muscles. Our next term is the opposite of weight-bearing. Non-weight-bearing. Non-weight-bearing. This adjective can be used to describe an injured limb which has to avoid any pressure. After surgery, he was on a non-weight-bearing protocol for 6 weeks. Pain-free. Pain-free. We use this term to describe when one is without any discomfort or pain. She was relieved when her knee became pain-free after treatment. Progressive. Progressive. We use this term to describe when something like an injury or condition increases in difficulty or intensity over time. Let's check out our example sentence. The therapist used a progressive approach to increase exercise intensity. Isolated. Isolated. We use the term isolated when something like an exercise is targeting a specific muscle or movement. Isolated muscle exercises target specific weak areas. Controlled. Controlled. This term describes when something is done with precision and focus. Controlled movements help prevent injuries during rehabilitation. Unstable. Unstable. Unstable describes a situation or maybe a person's movement which is lacking balance or stability. An unstable surface forces the body to engage stabilizing muscles. Compensatory. Compensatory. Compensatory is used to describe situations where adjusting movements are made to make up for a weakness. Compensatory movements can indicate muscle imbalances. Inflamed. Inflamed. If something is inflamed, it is swollen and painful due to an irritation. Her wrist was inflamed after overuse at work. Restricted. Restricted. In physiotherapy, we can use restricted to describe a patient who is limited in movement or range of motion. The cast made her ankle movement restricted. Let's move on to optimal. Optimal. Optimal describes the best possible condition for function or recovery. The patient reached an optimal recovery state after months of therapy. Symmetrical. Symmetrical. Symmetrical is used to describe when conditions are even and balanced on both sides of the body. A symmetrical gait is important for proper walking mechanics. Overactive. Overactive. We use overactive to describe a person or perhaps muscles which are working excessively, often leading to strain. Overactive muscles can cause tightness and discomfort. And next we have the opposite of overactive, underactive. Underactive. And similarly, this describes a person or maybe muscles which are not working enough, and it can lead to muscle weakness. An underactive glute can lead to poor hip stability. Our final adjective and final word for this lesson is resilient. Resilient. To be resilient is to be able to recover quickly and adapt to movement. A resilient mindset helps patients recover faster from injuries. Well done, you've just learned 50 essential healthcare vocabulary terms focused on physiotherapy, movement and rehabilitation, a huge step in improving your medical English. Student members, don't forget to download your guide packed with all the terms, exercises and links to additional resources. If you're not a member yet but want to access, click the link in the video description.